Hi everyone. Today we're investigating the virtues of physio versus chiro. And with some injuries there is confusion over whether one is more beneficial than the other. And here at the City Clinic at King Street in Sydney, where they have both physio and chiro, it's the perfect place to do it. So Elizabeth, what's the philosophy of the City Clinic?
It's to get to the root cause of the injury or condition, and to also involve the patient in their condition and their care and what part they have in the management and in the treatment of their particular condition. We wanted to offer a clinic with many different disciplines, so that people could come basically take care of all their needs, from musculoskeletal issues right through to dietary needs and naturopathic needs. So it's internal and external.
So if I come here with an injury and I'm not sure if I need a physiotherapist or a chiropractor, how can you help me choose which one is best for me?
Well, the first thing is we do ask whether people have a preference. But if they don't, we basically talk them through how each practitioner treats, and then they make a choice. Because quite frankly, we know that either the physio or the chiropractor can treat most things dealing with musculoskeletal issues. They do that day in, day out, every day.
Tell me what being a chiropractor means.
Well, what chiropractor means? Well, a chiropractic is all about restoring the function of the body. Over time, wear and tear kind of causes your spine to not really function as well as it could be. Once you restore that functionality, the body generally responds by performing better. There's less pain, you know, these types of things.
So what kind of things do you specialise in?
Well, active release has really given me the skills to be able to really effectively treat hard to resolve conditions like tendinitises, shin splints, you know, other type of running injuries, sciatic problems, these types of things where the problems mainly fundamentally lie in the muscles or what's, you know, kind of holding all the bones together. With chiropractic, you're able to treat how the spine moves, and if what's holding up your body, like all your muscles and bones, isn't doing their job, you know, the muscles have to work far too hard. But I guess where my focus lies is in repetitive strain injuries, where it's more like the accumulation of injury over time, and that just plagues office workers in the same way as it plagues runners. You know, they're doing very repetitive things day in, day out, and this takes a toll on their body. It's never a case of, does a person just need muscle work, or just need their spine corrected, or just need a home exercise program. It's always a case of they need everything. I've always wanted to be able to treat, you know, anything that kind of came into the office and stuff like that, so that's why I've kind of chose to treat it from both sides.
Great. Hi Hayden.
Hi, Lisa.
So you're a physiotherapist.
Correct.
Tell me what you do as a physiotherapist.
I'd consider myself a manual physiotherapist, so I do a lot of hands-on techniques, which includes mobilisations, manipulations, or what a chiropractor would term adjustments. When the patient is obviously comfortable with that, and if they don't feel comfortable, then I'll simply use other techniques. Definitely soft tissue therapy, do a little bit of electrotherapy, I use some acupuncture, and then obviously involve in my treatment a lot of exercise-based things, whether it's strengthening, stretching, things like that.
What's your philosophy around how you treat patients?
Look, I think I like to involve the patient in their recovery or in their rehabilitation, and I don't just like to set out a strict plan and say, look, you've come in with this knee problem or this ankle problem, and this is what I'm going to do and this is what you're going to do. I like to, obviously with them, sort of set out a plan and a goal, get an idea of what they want to achieve and what they're expecting and what they want to get back to, and involve them in sort of a structured plan towards that. So rather than just sort of saying this is how we're going about it, the person's more likely to sort of stick with the plan, and obviously as an effect of that, probably get better results.
Thanks Hayden. So what we've learnt today is that choosing either a physio or a chiro is pretty much down to personal choice, and that the great thing about the City Clinic is that here you have access to both with unbiased and independent advice.